Okay, good evening, everyone. Welcome to tonight's meeting. And firstly, let me apologise for being a little bit late. As you can see, the weather outside is absolutely glorious. So it took me a little bit longer to get here than I anticipated. My name is Councillor Bora Kwan, and I'm the chair of the Health and Wellbeing Board. And I would just like to say that it's a pleasure to be here. I have just returned from a period of medical leave. So if you I have been a member of the board for a while and wondering who I am, our deputy leader, Councillor Sanderson, has been covering for me whilst I was on leave. So she'll hate me for saying this, but thank you so much for chairing the meetings whilst I was away, and I'm really pleased to be here. Okay, so before we start, I will just run through a few housekeeping points. The meeting is being live streamed to the Council's YouTube channel, and by participating, you are consenting to being recorded. Please could officers and guests introduce themselves when they first address the committee. We might know each other, but there might be people watching who need an introduction. So I will just come in and remind you if you forget to do that, as we quite often do. And if the fire alarm sounds, please leave the meeting in an orderly fashion by the staff fire exit, which is behind me and to my right. The officers will direct you to the assembly point, which is in Riverside Gardens. We have a membership update. So as noted at the last informal meeting, the board now appoints Diana Barham, Chief Executive of Local Voice, as our new Health Watch representative. So welcome, Diane. And we also take the opportunity to welcome two new directors to the board, Dr. Mayada Abu Afan, the new Director of Public Health, and John Morley, the new Director of Adult Social Care. And may I offer the board's warm welcome to all of you. Right, apologies for absence. We have received an apology for absence from Detective Chief Inspector Matt Hogg and no one else. And could I ask, do members of the board have any declarations of interest? No, I don't think they do. Okay, moving on to item number 3, which is the minutes and the actions. Do members agree to note the minutes of the informal meeting, which was held on the 10th of September 2025? Agreed. Agreed. Thank you. At the last meeting, which was an informal meeting, the recommendations made in respect of the report on the Better Care Fund 2025-26 and Q1 report 2025-26, they will need to be formally agreed at this meeting. Do members agree? Agreed. Great, thank you. So the number 1, that the board ratifies the planned total expenditure and the proposed schemes in the Better Care Fund for 2025-2026. Agreed. Yeah, that the board ratifies the BCF Q1 report for 2025-2026. And number 3, that the board receives an end of year report outlining the outcomes of each scheme and the difference it has made for the residents of H&F. Agreed. Sorry. Okay, so we will now move on to related number 4, the Better Care Fund Q2 report, quarter 2 report 2025-26. So I will turn to Sarah Bright, who is our, I will leave you to introduce yourself, and then Sue Rooston as well.
Good evening, everybody. I'm Sarah Bright. I'm the Director of Transformation, Commissioning and Partnerships for the People's Department. And yes, we're back here with the quarter 2 report. As per the quarter 1 report, we always seem to be a little bit behind to update on the latest position with regards to that. The timing of these, the governance for this is not entirely in sync with the NHS governance. So it does seem to fall that we are kind of always retrospectively approving these reports, and we are already in the process of doing our quarter 3 report, which will also be coming through in due course. So similarly to the last item that you have just referred to, this is the update of the quarter 2 position. The Better Care Fund, for those of you who don't know, is an ICB funded programme to support adult social care to work effectively with our NHS colleagues to support and prevent admissions to hospital and support integrated working together. The papers outline the spend for quarter 2 and a summary position of our key performance indicators against the targets that we are required to report to. And there are no issues to report. We're on track for all of our key performance measures. around avoidable admissions, discharge to normal place of residence, and residential admissions. Is there anything further to add, Sue?
I don't think there's anything further to add other than saying that we are, as Sarah said, preparing Q3. So that will come, I think we've got to submit that by the end of January. So it's here for ratification this evening. Thank you.
Okay, thank you very much. Do any of the members have any questions or comments on the item? No? I think we're all looking forward to the next one. Oh, apologies, Sue.
Hi, Sue Spiller from Sobus. I was just interested in the overspend on community equipment. Is that because the alternative providers are more expensive, or there's been an increase in demand? And do we think we'll be able to reduce that back down in the next quarter?
I can respond to that. You may have been aware that there was a recent collapse of a provider in the market nationally, which we were required to respond to. We have worked together with our partners in both health and across London, because we were part of a 21 borough consortium arrangement with that provider, to put in place alternative arrangements really quite quickly. That has incurred cost, as you would expect. We now have a new provider up and running, which we are very pleased with. And we are also seeing, as part of working with that provider, increased efficiencies, particularly in terms of how we are recycling, which is great. So we are anticipating that we will see improvements as that provider establishes. It is a brand new provider. It didn't exist before. We have mobilised an entirely new enterprise, which is great for the market. And a new partnership with 8 boroughs across London in the northwest and north central region. But we are looking forward to seeing how that progresses as it establishes.
If I could just again extend my thanks to Sarah and the whole team for working so hard to mobilise in what was an impossible situation, where we had people who were going to work with us who vanished along the way. It was such a difficult, tricky position to be in, and to have something as brilliant as we have now at the end of it, I think really is commendable. So thank you so much for all of the work and stress, and I'm sure considerably grey hairs that we all instilled in that period, and well done.
Thank you. Are there any other questions? Yes.
Hi, I'm Diane Barham from Healthwatch. I'm just thinking you're in the third quarter now, aren't you? So one of the things that Healthwatch is trying to focus on is looking at particular cohorts and inequalities lens. And I'm just wondering if that's something that we might be able to think about doing, is getting some user experience from particular cohorts around particularly around just discharge and the equipment contract, just to see if there's some sort of inequalities that are potentially there.
I don't see why not. I think we can pick that up in probably the later piece that we've got on the agenda for today. But yeah, I think that would fit in really quite nicely with what we are doing. Thank you.
Great. Okay, I don't see any other hands, so we'll move on. Do the members agree that number one, that the board ratifies the BCF Q2 report for 2025-26, which is Appendix 1, and that the Cabinet Member for Adult Social Care and Health, which is myself, receives an end-of-year report outlining the outcomes of each scheme and the difference that it has made for the residents of Hammersmith and Fulham? Thank you. Okay, we will move on to item number 5, which is the Family Hub annual report for the years 2024 to 25. And we are expecting a presentation from Philip Thompson.
Thank you. I'm Phil Tomsett, Head of Family Hubs, and I work within Children's Services, within People Services. So I would like to present the report for the family hubs across the borough. For those of you who aren't aware, we have 3 family hubs across the borough and additional partner venues, which are conveniently located for residents to access, and also placed within areas of high deprivation and high need for family services. The family hubs aim to offer a single point of access to families to receive comprehensive support and better enable families to access those services. Contained within the report is a range of outcomes that have been taking place over the period of 2024-25, and key data highlighted within the report demonstrates that there has been a high demand for this new service area. There have been high numbers of requests for support from our families, including referrals to our new role, the Family Navigator, within each family hub. Families report positive outcomes through various feedback loops and surveys, and also outcomes from the interventions that take place within the family hubs that our families access. Target families have been reached effectively. We have services around cost of living, as well as parenting and access to a range of service providers. The service also were awarded a national award for Best Local Offer, which is part of our Family Hub website. We have managed to sustain very successful partnerships across the year and continue to do so this year. All our families who responded to our survey within the year felt either welcome or very welcome. And we have managed to successfully obtain external funding from the DfE to enhance our offers. Those are the key areas I'd like to highlight. Thank you.
Thank you very much. Very excited when found out there one was coming to the ward that I represent. So yes, do we have any questions or comments from the board? Yes, Dr. James Kavanagh.
So hello, I'm Dr. Kavanagh. I'm the Borough Medical Director. I'm a local GP. I think this is a fantastic asset for the community in the different parts of Hammersmith and Fulham. I'm interested to hear the thoughts of the organisations that are involved in this as to how they think they can be involved in the evolving neighbourhoods in Hammersmith and Fulham because of their positioning, and in what way we could help you to be more involved in this evolution of neighbourhoods.
Thank you. Yes, so I am already involved, and colleagues are also involved in some of the working groups that are taking place around the programme. My involvement is in the place-based aspect of the neighbourhood health offer. We work very closely with our local GPs. We have been very much part of the child health hubs and the MDTs that take place across the borough. So we have already very good partnerships with key staff within health, and we hope to extend that partnership approach, particularly through our reforms that are taking place within Best Start in Life and the Family First reforms. So neighbourhood health is very much part of the reforms that we hope to make sure that we don't overlap or duplicate any services, and that we enhance each other's offers.
Councillor Sanderson?
Thank you. I just want to say I really welcome the report and how wonderful it is to see the family hubs moving from pilot phase into a really well embedded part of our local system. And how brilliant it is to see all the partnership working and it become more and more embedded, and the emphasis on co-location and integration that we're seeing with health and voluntary sector. So long may that continue, and looking forward to seeing the next iteration.
Thank you. I think the breadth of services that are offered at the family hubs is really impressive. And I think sometimes a name makes you think that, oh, it's just for people with children and so on. And actually, they really are sort of much wider and reach the community. So I think we could look in the future at how we better sort of advertise and educate the community around that. It really does serve everyone as much as they need it. Okay, so yes, Councillor Perez.
Thank you very much. Thank you very much for the report, and it's really a fantastic model. It's great to hear about the outcomes that it's having and how we're working with partners and in collaboration and co-production as well to get the results that we're getting. Congratulations as well on the award. That's very positive. Are there groups that may be underrepresented, maybe in terms of the registration that we have and attendance, that we need to, I don't know, take maybe other steps to make sure that they're aware of the service?
Yes, so we have a registration process for family hubs. So we know what families do attend and those families that don't. There is a catchment area for each of the family hubs and our partner venues, and we cover almost the whole of the borough through those catchment areas. However, there are pockets of the borough where we know we don't have as many families as we would like. So we plan next year to develop an outreach program that targets those specific areas. There are some estates particularly that we know that we're not reaching. So we would like to invest further resources in reaching those particular families.
Excellent. Thank you very much. It's great to hear that the model now will have an outreach aspect of it. And one follow-up question, please. In terms of the online support, and in terms of accessibility, how we're ensuring that families that may not be that may be digitally excluded are accessing the services?
Yes, so the online offer is really to enhance the offer that's provided within the hubs. So that's our first port of call that we promote to families, is the physical buildings and the outreach activities that take place either in partner venues or within community centres. And we also are going to provide more outreach offers within libraries across the borough as well. So yes, so the online services are really an additional resource.
Councillor Jackie McShannon, Director of People Services, and we did take feedback last year, particularly through the Children's Education Policy and Accountability Committee, about the need to constantly review our comms, who we were reaching and how we were reaching. And in fact, some of that involved us going to more tenants and residents associations and just starting to think just beyond the sort of normal routines. So, and we recognise that we have to keep doing that, and that takes time and effort. But actually, I really want to commend the team, because we did act on the feedback that we got, and Phil and his team have sought other routes, and we'll continue to evolve that. Thank you.
Okay, I don't see any other questions. So, do the members agree to note the report? Thank you. Now, moving on to number 6, the Hammersmith and Fulham Pharmaceutical Needs Assessment, 26-29. Susan Hughes, I believe, we will have a presentation.
Can I just give a brief introduction? So, really, I'm pleased to introduce this needs assessment. It's a 3 years, and the board is required to undertake a PNE or pharmaceutical needs assessment every 3 years. Strategic needs assessment is not just a legal requirement, because it matters. Now pharmacies are opening longer hours. They are having more input in prevention and in reducing demand on primary care and on urgent care. So this needs assessment really it will help the board to manage emerging risks in terms of closure of pharmacies, relocation of pharmacies, and make sure the pharmacy provision is equitable across across the borough. So I'm really pleased. So Susan will take us. So my final word is the needs assessment showed that our provision is good, it is equitable, and it does have good coverage and good access, but there are recommendations. So Susan will take us through the findings. Thank you.
Apologies for earlier. I was trying to join and hope this works. Okay. I've just got some slides to take you all through, if that's okay. Thank you. Okay. So as Maya has explained, we're here to ask for approval for Hammersmith and Fulham's pharmaceutical needs assessment for the next 3 years as our official picture of pharmacy access and need in the borough. As Maya said, overall coverage remained strong within the set criteria that we base the assessment on. But the report also commits to us listening to residents about queues, stock issues and opening times in order to keep improving pharmacy services over time. So yeah, just a little bit of context and background. So this is a statutory assessment that has to be carried out by Health and Wellbeing boards every 3 years. The review, it's for NHS, it reviews current NHS pharmaceutical services for local population. It supports NHS on decisions on new pharmacies and also changes to existing ones, and also guides our local commissioning for pharmacy services. It's produced in line with the 2013 NHS pharmaceutical and local pharmaceutical services regulations and guidance. And it was developed by a commissioned service who the council appointed as an independent provider called Healthy Dialogues, who worked with local partners. And we had a H&F P&A steering group, which consisted of members of the local pharmaceutical committee, public health colleagues, business intelligence, Health Watch, H&F Communications and NHS North West London ICB. Okay, so these are some of the strict perimeters. I'll just quickly go through them. Again, has to be developed every 3 years. It must include mapped pharmacy provision, so assessment of necessary and other relevant services, identification of any gaps, any needs for improvement or better access, and consideration of local demographics, housing growth, and also cross-boundary use, so those pharmacies near our boundary. It requires a minimum 60-day statutory consultation, which was carried out with specific bodies. So these are pharmacies, GPs, Health Watch, NHS England, and neighbouring health and wellbeing boards. Must use robust and up-to-date evidence, so JSNA, NHS data and planning information, and document a documented steering group process so that NHS England can rely on the P&A for market entry decisions. Some of the criteria that was agreed by the P&A steering group to determine the level of access within the borough to pharmacy services. So what we looked at was how well pharmacies meet local need. Access was key, so how far people travel, how long it takes and when pharmacies are open. Proximity to GP practices, demographics of the population and health needs. So the map of pharmacies used by H&F residents shows within a 1 mile zone around each. This makes it clear where walking access is strong, but also where we could keep an eye out for emerging gaps. So some of the key conclusions about coverage, access and services. So we have 37 community pharmacies plus 1 distance selling pharmacy. So this is a pharmacy based on Goldhawk Road that is roaming and online in the borough, and that's 2 pharmacies per 10,000 residents. So this is above the England average. We also have 82 pharmacies within a mile of our border. Pharmacies are well distributed across wards and deprivation levels. So almost all residents can reach a pharmacy within 20 minutes on foot, and every GP practice is within 1 mile. We've got, in terms of hours, so we went beyond just the simple geography of where the pharmacies are. So we looked at opening hours as well. So we've got 29 pharmacies in H&F and 66 within the mile of our borders, which are open past 6 p.m. on weekdays. 32 out of 37 borough pharmacies plus 74 nearby are open on Saturdays, and 5 pharmacies and 22 outside of the borough are open on Sundays. Nearly all pharmacies deliver key advanced services beyond necessary. So Pharmacy First, new medicine service, which started in October 25, flu and COVID vaccinations, hypertension case finding, emergency contraception services, and smoking cessation. An important note is to factor in that the H&F pharmacies dispense on average nearly 6,000 items per month. This is well below the London and England average, indicating capacity to meet current and future need over the P&A period. So formally, the conclusion is that there are no gaps in provision, meaning locations, hours and capacity all meet national guidance and they compare well with our neighbouring boroughs. But we know that no gaps doesn't mean there are no local issues, which is why we will continue to work with pharmacies and partners and look at take on board what residents have told us. I'll just go through that on the next slide. We led on a public survey with residents, and 77% of survey respondents used a pharmacy at least monthly. 95% can get there within 20 minutes, mostly by walking. We had some positive feedback. So pharmacies, they're finding pharmacies professional, approachable and knowledgeable staff, and are trusted. The convenience of local pharmacies, the strong appreciation for things like repeat prescriptions and home deliveries, and recognition that pharmacies play a key role in reducing pressure on GPs. But there were some concerns raised, so things like evening and weekend access for some branches. Not all of them are open after 6 p.m. and on weekends. Some stock shortages were reported, long queues in some branches, and also some communication about prescription readiness and the impact of pharmacy closures for some neighbourhoods. So whilst it's deemed that there are no current gaps in pharmacy provision, the aim of this is to strengthen services and manage future risks, as Maya said, with a particular focus on prevention and supporting long-term health conditions and inequalities. So H&F commission services that will continue to work with pharmacies for things like screening, alcohol harms, drug misuse, vaccination uptake, suicide and loneliness, especially in more deprived wards and among priority groups. It's important that we improve access and experience by addressing opening hours, stock issues and GP pharmacy patient communication. It's important that we listen and respond by sharing P&A engagement and resident feedback with local contractors, the pharmaceutical committee, promoting pharmacy messaging and use of consultation rooms. To monitor and escalate by working with Healthwatch and patient groups to track queues, advise quality and accessibility, and also to report regularly back to this board on themes emerging and actions taken. What we also want to do is plan for access by using planning and regeneration processes to consider pharmacy access when assessing closures, new developments and town centre changes. We would also like to develop a P&A dashboard where we can log opening hours, where pharmacies are, the services that they're delivering, and also the feedback that we're receiving as well, so we can look at trends. So in conclusion, the London Borough Pharmacy of Fulham is well served in relation to the number and location of pharmacies. there is good access to necessary and other relevant advanced pharmaceutical services, with no current or anticipated gaps in provision over the next 3 years. Pharmacies continue to be seen as a key partner addressing alcohol and drugs harms, sexual health, and so on, through signposting and commission services. We've mentioned about supplementary statements. So at the time of drafting this, the population growth has been assessed on using high-level projections only. So once more detailed housing development plans are confirmed, any implications on pharmacy service provision will be considered through a routine P&A review led by public health team and the steering group, and the potential for supplementary statements as required will be read in conjunction with the main document, and supplementary statements are used when there's a risk of change of availability of pharmacy services. So our request today is for the Health and Wellbeing Board to approve the H&F Pharmaceutical Needs Assessment as a statutory assessment of pharmaceutical need in the borough, to authorise its publication and to agree to use it for future applications for new or relocated pharmacies and guide commissioning of additional pharmacy services where these improve access or quality. Thank you.
Thank you very much. Okay, I've got a few hands up. I will go to Sue first.
Thank you. Great report, Sue. Thank you very much. Very comprehensive. I'm interested to know whether you had any thoughts on whether the widest range of pharmaceutical services are being taken up by residents, and whether some of our colleagues maybe think that people are still going to GPs or acute services instead of going to pharmacies, and whether there was any understanding of the cohorts of people that might do that, and whether there's better information that we need to get out, so on and so forth.
Sorry, getting used to it. Yeah, most definitely, Sue. So some of the feedback that we'd had, and actually me working with, as an example, the family hubs. So they'd specifically requested a list of available pharmacies for the families that were going to the family hubs. So we were able to provide them with that definitive list. There's also the possibility of doing like an interactive map of where the pharmacies are that residents can access. But yeah, there is, I do, in some of the feedback, I wonder whether there are cohorts as in carers, people that are caring for people, whether they know that their local pharmacy does actually maybe deliver prescriptions and things like that. So whether they actually know that what's actually available from their pharmacies. I think there's a few that maybe don't know much about, as much they should, about Pharmacy First as well. So yeah, there's definitely some scope to improve that.
Sorry, Chair, can I just add, there are two elements to services in pharmacy. Pharmacy First is commissioned by NHS England. They pay for it and they follow it up. We commission services like HIV testing and others. The services we commission, we can, because we record the access and because it's related to payments. So this information we do have in terms of public health commission services in pharmacy. But in terms of the impact of pharmacy on reducing demand on for example, for UTI or minor ailment, it is the NHS will have that data, not us. Thank you.
Okay, I'm going to come to Dr. James Kaznar next.
So thank you for the report. And just to emphasise, the Pharmacy First service is commissioned by NHS England, and the data around the use of the services is there. And the service is widely broadcast and advertised through GP surgeries and other facets. I'm going to ask a question about some more detailed areas of the prescribing and the pharmacy services in Hammersmith and Fulham. We have a large cohort of pharmacists that have now joined practices through a form of recruitment that's again been funded nationally to increase the diversity of workforce within GP practices. And I think it might be useful to map pharmacies against pharmacists within PCNs and, as we go forward, neighbourhoods, because I think some areas are very well supplied with in-house pharmacists who do a lot of the work that pharmacies would do, but I think there's probably service gaps where some PCNs have been unable to bring on board pharmacists. That might help us to understand the work that's flowing in and out of the different services that are provided. But I've also didn't see in the detail of the report how many pharmacists actually offer to deliver medication to people's homes, how many pharmacists work with nursing homes, how many pharmacies have good relations with the PCNs that they receive prescriptions from. So there's a little bit more detail that would help us to really understand whether the access and the quality and the symbiosis of the different pharmaceutical services that exist in the borough are properly serving their communities.
Explain, because we have to follow a very strict process, but what you raise really important, and we can do that in parallel to the pharmaceutical needs assessment. Yeah.
Thank you. I think the report, I think, reflects how important pharmacies are not just as kind of shops and, but they're a sort of extension of the health service these days, but they provide that sort of personal human touch, I think, sometimes when everything feels like it's sort of going digital and so on. So I think having this sort of overall strategic view of these spots and how they're used and so on is really valuable. And then I think I'm surprised that they're saying every 3 years, because I think the pace of change in sort of digital services and so on. So I will be asking for the board to approve it 2029, but it'll be interesting to see whether there are new developments that we will actually take on board within the industry and within the health service that necessitates some sort of update in that time. So if there are no further questions, I will ask, do the members approve the Hammersmith and Fulham Pharmaceutical Needs Assessment 2026 to 2029 for publication? Yep. And also to delegate authority to the PNA steering group to determine whether future changes in pharmaceutical services are minor, which would require only a supplementary statement, or sufficiently significant to warrant a new PNA within the next 3 years, and to report these decisions to the Health and Wellbeing Board. Great. Thank you very much. Okay, we will now go on to item 7, which is the Health Watch annual report.
I think that's over to me. So just a little bit of background on this, which you did obviously mention earlier, Councillor Kwon. So this is the annual report from our previous provider of Health Watch. We have a statutory duty to provide Health Watch services, which is an independent organisation that helps amplify the voices of our residents who are obviously using our health and social care services. So on behalf of the previous provider, we're bringing the annual report through, which we have summarised as part of the cover paper, some of the recommendations and the findings and the developments that the previous provider had been working on as part of that. And we wanted to introduce obviously our new provider, so Local Voice, similar names, but new provider, and to introduce a way of working with them on following up some of the great insight and developments and recommendations from this report. So we don't want to lose the work that's gone before, as it's very, very insightful, and we want to use that to really inform how we progress and improve and develop our services together with our health colleagues in a much more kind of meaningful way. So I think what we want to be able to do is work with Health Watch very closely in collaboration with our health colleagues to really focus in on some of the key areas that they have identified in this report, so that we can actually really kind of focus in, target some of our resources and make sure that we're using that insight in order to actually turn that into tangible outcomes and improvements and impact that we can see. So the report essentially summarises some of the recommendations and some of the key developments from the previous provider, but also sets the scene for a future way of working with our new provider, Diane. And we've been working really closely with our colleagues and with Caroline Farrer to think about how we make best use of that information and the work that Health Watch does together with us to really inform those service developments. So it's brief. It's a brief item.
Thank you. Caroline, would you like to then speak? Yeah.
Yeah, thank you, Chair. Caroline Farrer, Managing Director of the Hammersmith and Fulham Health and Care Partnership. Yes, thank you, Sarah, for introducing it. And it's nice to meet Diane in person too. Yeah, I think what we really welcome is the concept of, because the three key priorities that have been identified as areas of focus for 2026, what we're really conscious of is that these are already key priorities for services and they're already working really hard on trying to improve. But what will be really helpful, I think, is if we can bring the additional insights that the engagement and work that Healthwatch does into that conversation, so that we're having that discussion in the round and supporting more of that co-production approach that will be helpful in giving services live feedback as they undertake their improvement work. So that's the concept. And yeah, so really pleased to be working together with Healthwatch on that. And that's on behalf, of course, because I'm not personally responsible for any of the services, but working on behalf of the whole partnership and working with colleagues in provider trusts as well as the local authority. Thank you.
Thank you. Okay, do the members have any questions? Oh, yes, sir. I need to swivel my head a little bit further. Thank you. Yes.
Sorry. Yeah, I guess it's just a bit of a plea to the members of the board as well. I think one of the things that we really want to focus on is that we're asking people for new insights, not old insights, that, you know, if there's already information out there, that we, you know, we join up our information so we've almost got a common source of community insights that everybody can draw from. And I guess the benefit in that is you get more out of it than you put into it. So if everybody's sharing their information, you've got a bigger pool of information that you can actually work on from. So we're really keen that we're not asking people the same old questions. We definitely want to go out and talk to people at the point of service, but we want to make really sure that it's something, sort of a wicked problem, the issue, focusing on particular cohorts so that we're actually moving things forward. And then I don't think it's been mentioned that we're also partnering with SOBIS and W12 together. So again, it's about once you've got all that insight and information, you've gathered it, that we're really co-producing that with local residents, that they're coming up with the recommendations, and we're working with partners to do something that's really based in neighbourhoods, hopefully. So yes, not doing the same old thing, but doing it differently, I think is what we're trying to do.
Thank you. Okay, are there any other comments or questions? No, if not, thank you very much for the update. And do members agree to note the report?
Agree.
Thank you. Okay, and then on to item 8, which is the verbal update on the ICB.
Yep, this is me. Yep. Thanks, everybody. I just wanted to update on further changes to the ICB. I feel like every time I have a substantive item at the Health and Wellbeing Board, it's around changes for the ICB. It was really just to give some space to have a conversation around the fact that as of the 1st of April, 2 ICBs will merge, so North West London and North Central London. We will become West and North London ICB from the 1st of April. As a result and a consequence of that, there will be a 50% reduction in staff across both ICBs, but the commissioning requirement and the role of strategic commissioner gets ever increasing because we keep getting asked to commission different services and more services. So the work's not going away, but obviously it will need to be done in a very much a different format. So the focus is going to be very much around strategic commissioning going forward, and that will mean changes certainly from the people that you see from the Health and Wellbeing Board and the people that you partner with locally. So the staff have been under a consultation, a staff consultation from December. That completes this Sunday, in fact. So it's been a 45-day consultation with staff. And then there will be, and running concurrently with that, there's been a voluntary redundancy scheme, which is Treasury funded. And there will be significant changes to a wide range of staff sort of happening between sort of the mid-February through to the end of March, and it will also continue from the 1st of April. So all staff that are left in the ICB at the end of March will transfer to the new organisation, but it is extremely likely that there will continue to be redundancies into the first quarter of next year. Having said that, the ICB has got a new, working to a new blueprint. They will then work across 13 boroughs. So we will obviously the 8 in North West London and 5 in North Central. And they will still be responsible for all of the statutory functions and the statutory requirements. So everybody is trying to do their best to sort of make sure that nothing gets sort of missed down the gaps, and there will be lots of things that we will still be required to do and provide. So we will work still on the ground across the 13 boroughs. So there still will be a presence and people that you can work with. Obviously, the partnership will be front and centre for that, but there will be a change in terms of how those functions are delivered going forward. So in terms of the landscape changes, there's going to be the ICB, which will be very much as a payer of services. So we will be going back to the strategic commissioning role and stepping away from the sort of the delivery and the transformation role in that sort of commissioning sense. We will still have a full range of providers across community and acute. And then obviously we've talked about neighbourhoods quite a lot. There will be a big focus on neighbourhood health and how we work very much at a local level, working with our partners, obviously including the local authority, but all of our community assets as well, including VCS. So primary care will still be organised as part of our PCNs and neighbourhood functions. So there will be integrated neighbourhood teams. And we will still have very much local accountability through there. There's still stuff that is really emerging. There's still stuff that hasn't sort of landed in terms of some of the statutory functions and where they might transfer in the future. But they are live discussions, and I think there will definitely be more feedback as we go through and sort of as those things get landed. But given that we are in ascend inspection at the moment, obviously those responsibilities will absolutely still stay with the ICB. And there will be around BCF as well, safeguarding, and obviously CHC and complex commissioning arrangements for individual patients. There will be local accountability around patients and residents as well, still be an active member of the Health and Wellbeing Board, but equally being able to shape the neighbourhoods and shape the neighbourhood strategy that I think will fall out of the health and wellbeing strategy as well. I think there's also going to be new relationships that will need to be established and obviously grown, and some of that will be around how councils work together across the 13, because there's obviously conversations happening, as well as health organisations working across that 13 and working across that footprint. I think in essence, it's going to be huge changes, and I think we are committed to keeping people updated. Obviously, we work with the partnership, so we'll keep the partnership updated as well. I think the thing that we also need to recognise that there will be a lot of change for individuals, and there will be a lot of individuals that won't be part of that organisation going forward, which is a shame. So we just need to make sure that we manage and not lose the corporate memory that we've established through the effective working that we've had with Hammersmith and Fulham. I'll leave it there. I'm happy to answer questions if I can, because some of it is still emerging, but obviously happy to take any questions.
It's a huge time of transition and transformation happening. So well done for summarising it in those few minutes. Right. Do we have any comments or questions from any members? No, I think we're all, oh yes. Sorry, Sue, I didn't see your hand there.
I just wanted to say, huge appreciation to everyone involved, because this is such a hideous thing for everyone to have to go through with such future uncertainty, and yet they're still having to deliver the job day to day. So congratulations and thank you to everyone involved, and you have our sympathies for the tough position you're in.
Yes, Dr. Kavanagh.
Yes, I think I just wanted to re-emphasize to the board and to people watching, there is a fundamental change happening here where we're moving away from a system that I've understood for at least the last 20 years, where there are commissioners at different levels, and then there are providers. And the responsibility of the providers is to deliver the contracts that the commissioners working with others decide is the right way to serve the needs of the population. And we're changing into a system, and others may feel I may not have this exactly right, but as I perceive it, where the responsibility to understand what is to be delivered is the provider's responsibility. There will be strategic goals set by the strategic ICS, but at a very, very high level. We'll have an ICS that now covers 13 boroughs. And there will be a no man's land between that organisation and what is happening at place. And there are opportunities in that, but there are also potential weaknesses in understanding what is the need of the population and how well a provider can meet those needs without the oversight of a place-based commissioning organisation that oversees the delivery of the contracts. And as yet, I'm not exactly sure how the governance around that works. And I think that is a big risk when we're looking at service delivery.
Thank you. I feel like we're on tenterhooks for what's sort of coming next, but it feels like we've been there for a long time as well. So I'm not sure whether we'll get any stability on that in anytime soon. But as I said, a huge amount of transformation and work going on. Are there any other comments? Yes, Councillor Roybottom.
Maybe it was very interesting from, sorry, my name is, I'm Councillor Helen Roybottom, I'm the chair of the Children and Education Pack. I just wanted to maybe invite Dr. Kavanagh to expand on that, what he thinks could be the best form or an opportunity, and what, sort of gaps might need to be, just if you wanted to expand further, I'm interested. That caught my attention, that's the kind of shift, but I can imagine that might be for frontline delivery an opportunity to align expertise at that level with a much, I can imagine people going either way and expressing whether that is a plus or minus. So
I think
if
my colleague would like to step in, but just beforehand, I see it as much more of an opportunity than a threat. I think we have extremely good organisations in Hammersmith and Fulham, and overseeing that delivery of services, some fantastically committed professionals. I think the gap at the moment is this uncertainty, which means people don't fully understand what the need will be after April. And so they are unsure of how to meet that need because of the change in the way the system works. But I have every confidence that there are great people, I work with them every day in Hammersmith and Fulham, who will step up to that once they really understand what the demand or the ask is. To me, at the moment, it's not completely clear.
If I'm just a final follow-up, do you feel, and feel free everyone to chime in, that if you were given any more bandwidth of, these are the outcomes desired, the money is never desirable in health, but these are the outcomes desired, here's the money, that there would be the right infrastructural relationships or whatever else is needed for you to feel you could put the kind of make the best of the opportunity, as it were?
It's a double-edged sword.
Yeah.
Through commissioning and through very tightly boundary contracts, the outcomes are dictated really by process. And many of my colleagues in different provider organisations have often said they felt limited by the constraints of a tightly overseen contract. And so the opportunity may be, the outcome we wish is A, it's down to you as a group of provider organisations to work together and reach that outcome with nuanced approaches that fit the population that you serve and the place in which you work. And that is a great opportunity. It unshackles people who feel their ingenuity or their ability to work with colleagues has been hampered by conflicting contracts. And so there is that opportunity. I think at the moment, people are unsure where the opportunity lies and how they can be empowered to seize it by becoming more progressive in their attitude to how they deliver an outcome outside of the constraints of what has been a very contract-led delivery system for the last decade and a half, 2 decades.
Very interesting. I'll pick up with you. Thank you. Okay, I'm going to come back to Caroline. Thank you.
Yeah, thank you, Chair. Yeah, I think it is a really interesting time and helpful of James, I think, to highlight some of the risks, but also the opportunities. Members of the board might remember the report that I brought in September, which was highlighting the 10-year health plan and all the other changes that are happening in the NHS, but also more broadly in the health and care sector. And I think we're in a period of flux, and that's what brings the uncertainty, really, because there are a number of what I like to call known unknowns. So we don't know the shape of the new some of the new GP contracts that are coming. We don't know the shape of some of the national contracts that are coming, and we don't know what the ICB, the new ICB, when it merges, what they will commission. What they have already done is put in place or asked providers and local authorities to put in place an infrastructure called integrator governance, which we have agreed and put forward Central London Community Healthcare as the host integrator, but working with the wider partnership to form that. But we certainly are on a journey to understanding how we might meet more outcomes-based contracts. Personally, I think that they will be held more tightly in the first initial period, for the first year or two at least, and there will be a transition towards greater freedoms and flexibilities. So I think that but it is a time of opportunity, but also of risk, and obviously of some sadness as we say goodbye to a number of colleagues within the system. So yeah, just being mindful of the amount of change that's happening in the system is, I think, helpful to highlight. And perhaps the board might want to consider inviting one of the ICB executive colleagues in March or June to talk about some of the changes that are happening and how they see it. And that might be a helpful conversation for the board to have.
Councillor Sanderson.
Thank you very much. I think one of the things that is certain is that the health colleagues will spend forever stuck in this process, because I think we all thought that local authorities were quite slow at moving, and then having to deal with the NHS is like nothing I've ever seen. So do not envy any of you trying to go through this process and it being very drawn out. I think within that kind of whole place of change, there is real opportunity for us in the Health and Wellbeing Board to think about how we can rise to fill that gap that Dr. Kavanagh has identified. Because there's an ever-moving path to further devolution, to further place-based decision-making in many ways. And so actually it's a real chance for us to grasp that and think about what we want Hammersmith and Fulham's health scene to look like. Whether the ICB is going to be effective or indeed even exist in a few years when it's got 13 different local authorities remains to be seen. I think we've got real questions about whether it can be effective at commissioning for a population that is the size of Singapore. So let's see, but I think certainly it's an opportunity for us to think about what we would like our health remit to look like here, and how we can use the board to deliver that.
I feel like that could be a standing item.
Could be a standing
for the future
item.
meetings.
And I think also what would be really helpful is to have the ICB report, but in a very, very succinct way, maybe keeping us updated as things go through, given the pace will be slow. But would welcome them here, I'm sure.
Thank you. I think we've had all the comments. Thank you very much. So do the members agree to note the verbal update on ICB? Thank you. Coming to the work programme. Firstly, do members have any suggestions for the work programme that they wanted to voice here whilst we're all gathered?
We've got a small event in May that maybe means we should not set a lengthy work programme.
I was going to say people are also very welcome to obviously contact us in between meetings as well via email. I know that sometimes they don't call. You don't have your ideas in sync with the meetings. And that takes me on to the dates of the future meetings. So the next time we are due to meet is 18th of March, and then June 22nd, which will be the other side of the local elections. So I think that really brings us to a close. Thank you for attending tonight's meeting, and good